It's now my great pleasure to introduce Dr. Peggy Kern to you. Peggy's been to South Australia before and is a treasured part of the team, really, through the Martin Seligman residency, and Peggy's been very helpful to us, and I know many of you have already met Peggy and worked with her before. Peggy's research focuses on understanding and measuring healthy functioning and evaluating sophisticated theories of psychological processes underlying health over time. More specifically, Dr. Kern examines how to define and measure health and well-being at individual and societal levels, and examines psychological factors that lead to and alter individual trajectories towards health and well-being over time. Her work incorporates innovative quantitative methods and interdisciplinary collaboration. She's recently developed brief measures of flourishing for adults and adolescents, and is currently studying how wellbeing assessment can be used to inspire positive change for individuals and organisations. Obviously, her research is right up our alley. Dr. Kern received a BA from Arizona State University and a Master's and PhD from the University of California, Riverside. She's published over 20 peer-reviewed articles and chapters. We're thrilled to have you back in Adelaide, Peggy, and thrilled that you're here to talk to us today about one of the exciting new developments in this area, the PERMA-Profiler. Please welcome Peggy.
Thank you so much, Gabe, and it's a real pleasure to be here in Adelaide. It's really nice to return here. I kind of like coming here in the summer. I came in the winter before, and instead I got to escape. I think we got over a foot of snow in Philly yesterday, so I'm really glad to not be there. So today I'm going to talk about just one project that I've worked on. I've been involved in a lot of different projects, working with a lot of different people, a lot of different groups and whatnot, and it's a really exciting place to be. So I'm at the University of Pennsylvania. I work with Dr. Seligman and numerous other colleagues, and it's really exciting to be just in this area. As Felicia noted, this is really a growing area. This is a science, and we're still learning a lot as we do things. And so it's really exciting to be just sort of a part of what's going on. So I'll share some of that with you today. In particular, I'm going to talk about a measure that we've developed with my colleague Julie Butler, who's at Oxford University, and then just the work that has really stemmed from that and where I see it going in the future. So, as we keep hearing with all of this, well-being really is becoming a new global agenda. We see things like in Bhutan, they're really focusing on well-being. In Santa Monica, California, they were awarded a $1 million grant to develop a well-being index. So they're really focusing on how you measure the well-being of citizens in a city. Other initiatives and whatnot are going on all over the place. And so it's very exciting to really see where this is going. And I think South Australia is really positioned to lead the way in a lot of what's going on. So it's very exciting. Now, Professor Seligman, in his recommendations towards South Australia, one message that he said very, very clearly is measure the well-being of South Australians. And really, positive psychology is a science, and measurement is a key part of that science. It's how we're going to build the evidence of what works, what doesn't work, and so my work is really focused on the measurement side of things, so that over time we can really build that evidence base and really continue to build the science as a whole. So that's his recommendation, and that happens to be the area that I really work on, and so I'll share some of that. So well-being measurement, that's what I'm here to talk about. That was the recommendation. And one of those ideas that I've been working with a lot is the idea that we can actually use the measures themselves in order to start to shift the perspectives, shift the way that people think about things. We are seeing that what we measure matters, that what we focus on is a key part of what really matters to people. So can we use the measures? Can we engage with kids, adults, and organizations in order to start to change the way that people are thinking about things and ultimately build well-being through that. Now, that's an open question. Maybe we can't, but that's an idea that I'm working with and will be studying over time. And a key part of that is we actually need measures in order to do that. Now, some of this, Felicia talked about a lot of this, so just to give a little background, traditional measures of well-being, we have gross domestic product or other financial measures. Interestingly enough, as early as 1968, Robert Kennedy said, GDP measures everything in short except that which makes life worthwhile. And that's something that's just so key to people is what makes life worthwhile. And I think that's one thing we're really doing with well-being measurement is trying to get at what really matters and what makes life worthwhile for people. A lot of the measures that are out there, whether it's at the societal level or at more individual levels, have focused a lot on lack of problems. This sort of get rid of the negative stuff. And in one sense, there's always negative going on, and we're always trying to dig ourselves out of a hole. And a question is, can we shift that perspective so that we're finding solutions in order to think about better futures, giving people a hope for what we really can do, as opposed to just trying to walk away from what went wrong. Healthcare, which is a lot of my background, is focused on health psychology. Talk to doctors. What is health if you're not talking about lack of illness, a lack of disease? It's something that is very, very hard to conceptualize. It's like, what does it mean actually living balanced and really promoting health overall? Education, we want our students doing well on things. Psychology has completely focused on the lack of ill-being, and that's really traditionally been one of the key foci, which is exceedingly important. There are the problems there, and we need to deal with that, but what else can we give people? Even at sort of the climate level, we often focus on, okay, how much pollution is there, global warming, things like that. How do we get rid of that? Instead of thinking about, healthy climate. So the idea here is a shift in perspective. We can think of the whole spectrum that Felicia talked about. The traditional perspective is often focused on this negative side and getting up to the middle. And so what we're doing in positive psychology is focusing on the positive, taking people not just to neutral, but to really thriving and living the optimal life that they can within whatever circumstances they live in. Now, there's a lot of times positive psychology is misperceived. And there's been a lot of focus on sort of the hedonic side of things. It's not just happiness, this positive emotion. That's one side of things. And I think the thing that I've really taken from positive psychology, when I originally started this, I was like, oh, positive psychology is like that happiness stuff, and you're not happy all the time. Really, there's so much more to it. Professor Seligman talks about flourishing, the experience of life going well, feeling good, functioning effectively, these different areas of life. You've heard a lot about the PERMA model. So being at UPenn, working with Professor Seligman, that's become a model that I've really focused on. I wouldn't say that's the only model of well-being. There's a lot of models out there. So this is one perspective. There are other elements of well-being that are important as well. But this is one area that we can really focus on. And so that's what my work has focused on. If we have this model, how can we really measure it and then ultimately build it? So PERMA is positive emotion, the hedonic side of it. Engagement, and I'll come more to what we mean by each of these. Relationships, meaning an accomplishment. I guess so I put those out of order. But so that's the basic model that we're working with. Now, why should we even measure PERMA? One thing is this idea that what we measure influences our perspective of things. When we're always focused on the negative side of things, we just get in this mindset of like, how's life? It's not the negative stuff. Can we actually start to think about, well, what does make life meaningful? what is well-being to me, and really challenging people to do that. So the measures can actually influence that. One thing I've found over the past few years as I've done this research is there's actually can be a lot of popular appeal to this. I've talked to a lot of people where just having this almost refreshing idea of wow, actually looking at the positive side of things, you know, even everything we hear in the news and whatnot always focuses on the negative. There's actually something sort of refreshing about thinking about, you know, the good stuff as well. One thing I think it can inform intervention. It can tell us where do we need to intervene, what is actually working for people and what is not. And this idea that I have that it can inspire change by monitoring it, in a sense, almost becoming mindful of how we're doing in different areas. Can we use the measures to actually help inspire that in some ways? There are other ways you can think about measuring PERMA as well, but these are a few here. So in order to measure this, I've developed a measure, or Julie Butler and I have developed this measure, the PERMA-Profiler. So I want to tell you a little bit about how we developed this. One thing that has gone into this is if we're going to measure things, we want to think a lot about, okay, we want to actually have reliable measures and things that actually work. And so I'll just briefly talk about a little bit of that just to show what we did in developing it. And then turn to some of the applications and where the work with it is really going, and potential uses where that might be useful to you. So developing the PERMA-Profiler, bit of psychometric stuff for anyone who's more mathy or wants to know the nitty-gritty there. One thing we did was we had to start with definitions. We had PERMA, and I had the book Flourish, and it's like, okay, well, what do we really mean by positive emotion or engagement or accomplishment? Which was kind of actually an interesting challenge because people in the field of well-being science don't even agree on what these different things are. So that was a challenge that we had to deal with. We did our own definitions, tried to meet a middle ground on things, but not necessarily, you know, others could disagree with us. We compiled over 700 items from different scales that were out there, just really creating this really big pool of things to think about how do we really measure these different items. Experts rated the items. Dr. Hefford helped us with this, and it was really fantastic having her expertise throughout this project. We reduced everything to about a 200 item bank. About 70 of those were directly focused on the PERMA domains, and then we had some other measures in there as well. This was a very long survey. It was took about 45 minutes to do, and I was actually amazed at how many people over the past few years have taken this measure and to really help us build this measure. So it's been very exciting. So first thing we had to do was define our different domains. Positive emotion. We're looking more at this general idea, so this general tendency towards feeling contentment, joy, etc. So we're doing this more than just sort of temporary or how did you feel today or yesterday or whatever. So we're trying to get at more general states of well-being. Engagement. Engagement is actually a very interesting construct. I've been increasingly seeing the importance of it in schools, in workplaces, thinking about successful aging. So how much are we actually engaged, involved in the world? So we did more of the psychological side of things as opposed to behavioral. So interest, involvement in the world, being a part of life. And I think the contrast to this is really sort of an apathetic approach to life, being bored, really disconnected from life. Relationships, feeling loved, supported, valued by others. Meaning, having a sense of direction in life. You have value and worth. And then accomplishment, we're looking at the subjective side of things. So accomplishment is probably one of the domains that you could do most objectively, thinking about how much people are achieving. We're focusing on the subjective side so that, you know, even if I'm a person that doesn't have any resources, maybe the big accomplishment of my day is doing the house tasks that I need to do for the day. So that's our focus there. The measure development, we had a series of samples. We used there's this data set called Mechanical Turk, where people actually go online and they'll do different studies and for very small amounts of money, and so people completed this survey. Dr. Seligman has a website, Authentic Happiness, where you can take different measures, and so there's a lot of tools available on there. There's a testing site on there, and so we were able to put it up there, point a lot of people, get connected with people to actually go online and take this measure. So we got a very large sample, actually, well, we had about 3,700 people that had complete measures on the PERMA measures, and we really took these 199 items, focusing on some of the items, and narrowed things down to a small set of items so that we'd get a short measure as opposed to something that takes 45 minutes to do. So a series of analyses ended up with 15-item measure. We chose to add some items on negative affect, so getting that negative side of things, and then also some health questions as well. Health is not part of PERMA. I actually think a lot of people have asked, why is it not? The physical side of things, actually, it's very important. So I'm measuring it anyways. And again, this is subjective reports of it. Then we further did this. We did the testing with another large sample. And then with the short measure, we had people complete just that one. And then 1,000 of those actually did it 2 weeks later so that we could actually look at how stable is the measure over time. And that's important if we want to use it to, okay, if I do an intervention, and I want to see change. If it's changing a whole bunch without doing anything, then that's going to be a problem. So we wanted to check that. This is kind of a mathy type slide, but it's just telling the measure reliability. Closer to 1 is good. You also don't want it to be 1 because then people are answering the same question multiple times. Now, each of these scales only has 3 items on it, so it's pretty short for looking at individual level, and yet the reliability looks really good on these. Also, cross-time correlations, it's pretty stable over time. And so, again, values closer to 1 are higher correlations, and then values closer to 0 are very low correlations. We actually see that without doing anything, people are actually pretty stable in these domains. Now, when we change things, then hopefully we can see some of these move. So our final measure, it's a 23-item measure. Takes maybe 5 minutes to do, not very long at all. The scale is actually on a 0 to 10 scale, so you can think of kind of having none to completely. And one thing we've done with this, it's the PERMA-Profiler. And the key part of that is we're looking at well-being not as a single number, but what is your profile across these different domains? And so we can really think about, well, what is a good profile? What's a bad profile? And how does that maybe vary for different individuals? Maybe different things are important for different groups, and we want to learn that over time and be sensitive to it. These are a few sample items that are on the measure. Just putting them together, asking people about things like contentedness, being excited and interested in things, feeling loved. So these are some of the items that are on it. Again, 15 items actually measuring the PERMA components as well as a few others. Okay, so we did all this work to put together this measure. So it was very important to us that we actually, put a lot of work and effort into it so that we know that this is actually a measure that we can offer to people that actually has strong psychometrics, so that we're actually using the good measures there. Since then, I've just had so many conversations and so many opportunities to really see all of this move forward. And it's been really exciting just seeing where this can go, and has really given me a vision for what we can do in the future. So I'll share a little bit of that with you, and I'd love to hear your ideas and how it could be useful to you moving forward. So the measure itself, it will soon be available as a regular measure on AuthenticHappiness.com. There are a series of other measures there, so it's actually a good resource for thinking about well-being, character strengths, grit, depression. There's a whole series of measures there. There are also measures there for youth as well. They're just revamping the entire site, so it actually it'll look really good for this decade or whatever. And so it's going to be a really good resource there. And how the report will be, you can actually take the measure and then you'll actually get your profile to see, this is my profile over time. One thing that's been really, really interesting to me that's coming out of this is this idea of translation and cross-cultural comparison. And this is something I'm actually very interested in, is, okay, there's PERMA. How universal is that? What changes do we need to make for different cultures across different languages? And so this is one area that I'm moving to in the future. The measure has now been translated into at least 5 different languages. So French, Dutch, Spanish, Chinese, Polish. I have several others that are in progress. So it's just been really exciting to do this whole translating the measures, and so that we can actually look at both other cultures and then how language affects things as well. I'm doing an interesting study with one of my students, and so he's from Malaysia. So we wanted to look at well-being in Malaysia compared to the US. So we put together the survey. We have the PERMA questions. We also asked a series of qualitative questions. So asking the people themselves, well, what is well-being to you? What makes life meaningful? And so we're actually looking at, okay, these are the responses that people do on the measure. And so we can compare that to our scores and say, okay, are they higher or lower? What's their profile, et cetera. But then we're looking at the bottom up as well. How much does it actually map on? And it's interesting because there is a lot of, we're in the middle of doing the analyses right now, but there is actually a lot of overlap between the PERMA domains and the people's perspective of well-being. But then there are some differences as well. You see things like even spirituality and things like that coming up. So it's interesting to say, okay, yes, we have a measure, we're doing that from the domains, but then let's learn from people as well. And I think it's actually kind of interesting when people take that and actually are stop and say, well, what is well-being to me? What does make life meaningful? So it's interesting to think of how we can bring those together. So that's one example, and then I'm doing that in other places as well. At some point, I'll put it all together, and we'll see where the science takes us. An extension of all of this, over the past few years, I've also developed a measure for adolescents. It's based on PERMA, but we made some modifications to it. One thing with the measure, we didn't want it to be developmentally, that because kids haven't developed as much, they're going to score lower on a measure. So this is something I just finished developing. I'll be doing a talk on this more tomorrow. So that's an extension, so we can actually do this in adolescents as well. And that the EPOCH measure has actually been tested in the US and Australia. So it seems to be the US and Australian measure of PERMA for adolescents. Another extension of all of this is spreading into the workplace. So I know some of you are from business, and this is kind of a newer area that I've been working on. I don't have a business background, but I've connected with some different organizations that are very interested in this idea of building the well-being of their employees. And I think there's a huge emphasis in that now, this idea that, okay, can we make our workers happier? With the whole idea that you're actually going to take less sick days. People are more connected at work. They actually work better because they actually like being there. And then ultimately it's going to drive profit. So that's really what businesses care about. But I think we spend so much time at work. So it's really important to think about, okay, how can we really build that? And part of that with the businesses is actually interesting because the idea of measuring things is actually a good thing because you want to show there's a return on investment, that if we're going to focus on well-being, it's actually doing something. So this is still being tested, and I'd love to consider how we can develop this more. So it hasn't been gone through all the rigor that the regular profile has, but we've changed the context of things. So instead of in general, how are you feeling, we're focusing on in the workplace, how are things? So it's kind of interesting to think of how we can make that extension there. Okay, so this is a little bit about the measure, the development, and then we can think about some applications of all of that, and that's what I want to spend sort of the rest of the time here. Before we do that, thinking about well-being, and I actually think the physical side and everything that we do is actually important with that, we're going to take a little break and just everybody stand up for a moment. Okay, so thinking about some applications of things, I'm going to talk about a few things. So I think there are a few ways that we can do what we can do with this. So the whole idea of developing measure was to have a tool, and then it's just a tool, and it might still need some modifications or we'll want to do different things with it, but it gives us a starting place to work with, a place where we can start to build this evidence of, how are different places doing and how can we actually change that, hopefully trying to build well-being over time. I think some things we could do descriptive characterizations of different places. We can gain some insights, what are strengths and weaknesses, track changes over time. I think a lot of this goes into this idea of the invisible hand of change. And then I'll speak briefly about some of my most recent work, bringing in technology. And I think that's a really interesting way to think of where we can go with this. So as I noted, the PERMA-Profiler is a profile across different domains. There's been different talks about, okay, if we're talking about well-being, it's happiness. We have gross domestic product, can we get a single number of happiness? And I actually think that the profile actually gives us more information. I can look at a profile and say, hey, you know what? My group is very disengaged with things. And so that would be an area we want to target for intervention. And so it actually informs much more targeted interventions. We can think about, okay, life satisfaction. We can do a whole series of general things in order to try to change things. If we know certain areas, then we can actually use our resources in a better way. So one thing we could do with this is we can think about, okay, how are different groups doing? And how can we compare them? This is some data with staff members actually at St. Peter's College here in Adelaide. So we looked at PERMA of the different staff members, and then we looked at some other measures. And so this is job satisfaction for those who were lowest on job satisfaction compared to those who were highest on job satisfaction. And then this is life satisfaction, so another area. The lowest people versus the highest people. We see a very different profile for those who are really happy with their jobs versus those who are not. Interestingly enough, for job satisfaction, we see things like engagement and relationships are actually a key part of what's making their job satisfying to them. So it's a key part of whether or not they like their work or not. Life satisfaction actually is the meaning component, which was much more related to life satisfaction. Do you have a sense that your life is valuable, that you have a sense of direction to things? So that was more for the general stuff, whereas the job stuff was more about, these relationships and engagement. And so we can actually make these comparisons for different groups so that we can actually target things to those who might be struggling more, and then help those who are doing well continue along that path. Another thing we could do, we can gain insights. So this was actually work with using the workplace measure here. So with a company, Etsy.com, actually a global company, and so we had people take this Workplace PERMA-Profiler. We also did organizational virtues. We had a social capital measure, also values, and so we could get their scores on these different areas. In this place, we were looking at different locations. So we actually saw that the Hudson location was actually doing really well on several of these measures. Paris was actually the lowest across these domains, going along with the French thing, which was kind of interesting. The one that I found most interesting was actually looking at different groups. You probably can't read this, but we saw with Wellbeing, the first place was the social outreach team. So those who were interacting with people all the time and really out there. The data people were actually the lowest well-being. So those who are always just by themselves working with the data, they reported lower well-being. Interesting enough, so last place across several of these areas was the marketing team. Now, we looked at that, we're like, well, why is marketing the lowest there? And it turns out, the CEO and the founders of the company looked at this, they're like, well, you know what? The marketing section had just gone through a big reorganization. And so everything was kind of like off. And this showed up in those measures. And so the leadership was able to look at this and say, that makes perfect sense, and I can explain that. But until we had the measures with the insight, you don't really have a sense of this. And so I think we can gain insight through the measures that we use. One thing I think is really where we need to go with things, so I get questions all the time thinking about, okay, well, you have these different measures, what are your cutoffs? You know, what's flourishing versus non-flourishing? And in some ways, I think where we're going to get the biggest thing is when we think about measuring it over time. You know, different people are going to have different levels that maybe is actually good or bad for them. What is the general trajectory that you're following over time? This is just made up data, but I can think, okay, if I take this multiple times, maybe that second point, something bad happened, and so areas went down, but then over time, my negative affect went down, and my P and my engagement actually really went up over time. So we could think about, you know, in these different domains, are you going up, are you going down, are you at least staying at a good level? And so it's interesting to think about how we do that. Now, Professor Seligman talked about this idea of the invisible hand of change. The whole idea of this is that what we measure, we value what we measure. The whole idea of this is if someone says, okay, your goal is to improve your PERMA. So what we're going to do is we're going to measure it, and we're not going to tell you how to improve your PERMA, but you're going to find a way. And it becomes a challenge to actually make change. So maybe you use some of the positive interventions that are out there, gratitude visit or mindfulness or savoring or these things, but people find ways. It's like tell your teachers, improve the well-being of your class, and we're going to hold you accountable to that. And so this is the idea that teachers find ways to improve the well-being of their students, for example. Now, this is something that still needs to be tested, but this is the idea that the measures can actually inspire change in people. This is the idea that's behind it. This was just a mini experiment that we did. So this was actually at the Positive Psychology Center. So Dr. Seligman was all like, okay, we're in a lab meeting, and he's like, I think we should try this whole invisible hand idea. So we're going to measure it, and then your goal over the next 2 weeks is to improve your PERMA. And so we all went off and did this, and people had to come up, and it was actually really interesting to try this. And you actually start to really think about, okay, what can I actually do to improve some of the different areas of my life? And I actually found myself actually doing things to actually make some changes. And we actually saw that over a 2-week period, on average, people actually went up. So negative affect went down, as we'd like to see, and some of the other areas actually improved. And it's actually kind of interesting because how the scale is, it's on a 0 to 10 scale. You don't remember what your last response was, and so you can actually see change there. There was also a lot of individual variation. So there were so the average overall went up, but there were others that actually went down, and so there was some variance there. And then it was interesting I asked people, okay, what did you do to improve your well-being? What'd you get out of it? So kind of that self-reflective thing. Just an early thing, but it's that whole idea that we're starting to work with. Now, this whole idea of measuring over time, obviously that takes time and resources, and that becomes very, very challenging. And I think this is where technology actually becomes very, very important, and it can be very, very helpful in thinking about tracking things over time, what are you actually improving on things, and making it a lot easier. And this is a whole growing domain. There's actually a lot of app developers out there who are really excited about well-being. There's actually several happiness. So most of the apps right now are focused on happiness. So you can do little things to increase mostly your positive emotion. Probably one of the best apps I've seen out there is something called Happify. So it's one that was more recently released. And it's really built on a lot of the positive psychology literature. And so you get some measures, and then you can actually, they give you a series of interventions, and so you can do like the savoring track. So you learn to savor things more. So it's actually really, really interesting. Different people will engage with it more or less. So I think there's more and more of that coming out, and we can think creatively about how we can really build that in there. Just an example of this, I've been working with a group hackathon. The whole idea of a hackathon is connecting happiness and action. And so the whole idea of it is you have an application, people measure themselves over time, and then take that information and then connect it to things in the community in order to actually, okay, we know that these are people that did this. How can we then connect them to something so that they can actually, use their strengths in the community, kind of feeding back and forth from that. Also, part of this is this idea of people can get that information back to themselves and so kind of track yourselves over time. A lot of this is built on this idea of the quantified self and just looking at that over time. Interestingly enough, so you think about with the mobile phones, technology is moving along more and more, and so we can start with surveys and give you survey questions more and more. There are things like physiological measures. We can do GPS to see where people are. So the idea is we can actually say, okay, where were you when you were feeling this way? What were you doing? I do this a couple weeks. I find out that, okay, actually, the times that I'm actually a horrible person is when I'm commuting. And I actually like, I bike everywhere, so I actually really like commuting. I also wouldn't be doing an app while I was commuting. But, and then we might find that, okay, actually when I'm spending time in nature, I'm actually like really happy then. And so I can actually learn that insight and say, hey, maybe I should actually spend more time in nature doing that. And one thing we're focusing on this is the idea of values. What do I value, and how much am I living in accordance with my values, and then how does that relate to my well-being? If I find out, okay, I really value health, and yet I spend absolutely no time doing anything to help my health, then maybe I need to reprioritize in order to actually build that well-being. So it's the idea of bringing that insight to people so that they can actually grow from it. We're doing a thing in the city of Reading, Pennsylvania, which is a kind of, it's a city, but then it's a pretty low SES area of Pennsylvania. Reading is actually going to do a whole week-long happiness campaign. They're starting with a whole workshop, and then they're actually going to be measuring things, working with Hackathon in order to bring this together. And then at the end of it, they're actually going to use the insight and connect people with different volunteer opportunities. And so there's really the idea of how can we use some of these tools and whatnot in order to connect people where it's actually going to help both the city and the people themselves. So just some of the examples of where this can go. Also, things like social media, and you'll hear a lot more about this afternoon from Johannes Eichstad. So a key to happiness are the smiley face there. So social media, there's just so much work, or so much information there. How can we connect that to PERMA? And so even bringing that in, we have the questionnaires, which are very, very important. Can we learn the language of PERMA and then incorporate social media as well? So that's a project I'm involved in, the World Wellbeing Project, and I won't say more just because I don't want to steal Johannes's thunder on that. So Professor Seligman challenged South Australia. He said measure well-being. And in particular, he said three things. Use measures that can be mapped to PERMA. So that's his focus. And so we want things that can actually relate to that. Use evidence-based measures. So we want things that actually work, not just giving any questions, but actually using that, and linking measurement instruments to interventions. And I think the PERMA-Profiler, it's not the end-all of things, but I say it's a tool to help meet that. So we did a lot of work to really make sure that it would be psychometrically sound, it'd be a good measure. We're doing work now to think about how can we link that to intervention so it'll be as informative as possible. And hopefully we can use this as we understand people more. We can use that to really build, not only measure, but then build PERMA, well-being, health, education, everything over time. So brings me to the end of my talk. Really excited to share some of this, and love to continue to the conversation, and if I can give you resources in the future, would be happy to do that. Thank you.
The very pragmatic question, is this proprietary, or is EPOCH and the PERMA-Profile available for people to actually use?
They're going to be completely open. They're both going to be on authentic happiness, which is the easiest way to get them, but we're basically free domain, and so we're really want to make these a tool that's really open to everybody. We're slowly releasing everything because we wanted to really check the psychometrics and everything first, but no, it's going to be open.
And I'm also finding in the work that I'm doing individually through coaching, working in the Seligman building, that a team of resilient people does not actually make a resilient team, and there is something around the collective.
Yep.
And it is about shared purpose, shared goals, shared engagement and alignment. But then that's not enough if you actually don't look systemically at how the strategy systems support that. And so they're my struggles, I suppose, in a few years of engaging and using a lot of the techniques in terms of building. So I'd just be interested, and I know you're saying you're moving into the workplace, but what your thoughts might be. It's a very long question, isn't it?
No, and that's fantastic. And actually, I love thinking about the systems approach to things. And it's something, so positive psychology is really focused, it's been focused, it says it's about individuals and organizations, but a lot of the work has really focused on the individual level. And I think there needs to be much more thinking about the organizations and how, one way we've thought about this is that the organization as a whole has certain goals. Individuals have certain goals. There is some overlap there, but we need much more thinking about how that conversation actually comes together. We've actually done some thinking about a well-being index, not necessarily the PERMA-Profiler or any of these individually based tools. How can we use that as actually a conversation to bring together different perspectives within an organization? So we've had very early thinking on all of that, and unfortunately I don't have any good answers that really bring it together. I think it's a real hole in where the literature is right now, but hopefully we'll move forward in the future.
Hi, I'm Sarah Jackson from Retail.com. One question is, right at the beginning of your PowerPoint was where you had men and women answer some of your surveys, and there was more females answering authentic happiness than the other one.
Yeah.
We do a lot of work around engaging young men, and how do you engage and how do you do it well in mental health. I'm just interested to know whether there's been thoughts or perhaps potential with how you're going to engage more men to answer and to be profiled through PERMA.
That's a fantastic question. I do not have an answer because I haven't thought enough about it. I've been thinking more and more about this idea of the user experience, both the idea of how they take the questions. I think as psychologists, we've gone into the 21st century enough that we've taken the questionnaires and we've put them online. And yet it's just it's a questionnaire, we lose people, and we're not thinking enough about how to actually engage them, and then also what people get out of it. And so I'm thinking on all of that, we're working on it some, but I don't have any good answers, and I'd be open to any solution or any thoughts you have. That would be fantastic. I mean, thinking about how can we actually take it, test it, work with people in order to make it more engaging and really connect with them, I would love to think more about that.
Yes, John.
John from Assure Programs. Peggy, sorry to throw you on the spot. I know we've spoken a few times. But is there a potential for there to be a dark side of PERMA? The reason why I throw this out there is a dark side of being mentally tough. There's a dark side of overusing and capitalising only one signature strength and not developing anything else. Is there a way to possibly explore the dark side of PERMA? Maybe, for example, achievement is extremely high, but relationships are very low. Is there a way to begin to identify a few hotspots there?
Yeah, I think that's a fantastic question, and I think we have this bias. It's like, oh, we want to make things good, like improve everything, and there should always be kind of this upward trend. I actually don't think so. I actually think that too much of anything is probably a bad thing. When we don't have enough of looking at different profiles to think of like what's a healthier profile versus not. But you can probably think of in any of these domains, it's possible for someone to, they're the high achiever that the relationships and everything else suffer. Engagement, we can see things like, people spend 20 plus hours online. They are super engaged, and yet their health and everything else suffers. So I think measuring it is the first thing to actually see that. And then we need those outcome measures, is look at things over time, and so we can actually empirically see what are what are better profiles, what's less healthy, and then so that we can actually start to, so we need the evidence first, and then we can start to answer that question.
Hi, I'm Jess. I work in philanthropy, and I work in adolescents and transition to adulthood from education. So the relationship between EPOCH and PERMA, I'm just wondering, is there a switch over, or is there a transitional kind of time, or I guess it's very pragmatic?
Yeah, that's a great question, and I think part of the reason we've done with the EPOCH is especially thinking about the early adolescents that haven't. So kind of like 11 to 13 age, that especially one thinking about sense of meaning is one. They can say they have a sense of meaning, but it's a very different understanding of it than adults do. And so in part, we didn't want different scores on things just because of that understanding on things. I think once you get to the older adolescents, we've tested things specifically 18 and up for the adults and up to 18 or so for the adolescent measure. But I think those really can come together so much, yeah.
Hi, my name is David Kelly, and I work primarily in the areas of ageing and disability. And there are a couple of principles that I'm struggling to pick up on a question that came before that I'm interested in your thoughts on, Peggy. One is that I think I do believe, as one of the earlier speakers said, that our communities are more than just an aggregation of individuals. So the measurement that we're doing is all well and fine, but I'm not sure that it gives us the whole picture and the systemic picture. What I'm really interested in terms of that concept is how our communities deal with the most disadvantaged. And so I'm thinking particularly about work that I've been doing recently in aged care facilities with older people who really have faced some significant challenges in terms of their choice of control, their levels of autonomy. So I'm really interested in the stuff you talked about at the end about community and how community is overlaid over some of this work. You talked about hackathon, but I'm interested in your sort of left field thinking about how we can move more broadly into overlaying notions of community and good community onto some of the more individually based PERMA style measurement tools.
It's actually a really good question, and I probably don't have a very good answer for you. I think as far as, I think one thing is, first of all, thinking about, okay, let's start changing the mindset of things and start, how can we actually, okay, working at more of a community level, how can we start to change the perspective, design things in a way that it can actually enable well-being in individuals? And start that conversation at the individual level about thinking about different areas of life. And I think the profile thing, especially for people that are struggling in different areas, actually becomes pretty important. Because, maybe because of limitations I have, there are certain areas that I'm never going to get high on. but how can we really focus on some of those other areas, whether maybe it's in aging, sometimes we see things like having a sense of meaning and connection can actually be really important. So it's really drawing on those areas that we can do that are going to work within my sphere. But then I think, especially at the community level, thinking about how can we design the environment, whether it's the people who work there, the structural environment itself, in ways to actually enable that within people as much as possible. How we do all that is a really good question, and I think definitely where science needs to go on things, but it's an early field, and we don't have good answers at this time.
Well, I just wanted to ask if you have done, because I think that the PERMA profile has a great opportunity to identify where we can intervene. So have you done, like gone in and done the PERMA profile in people in nursing homes, or in people on ventilators at VentCorps, or so that you would actually know, instead of guessing, what these people are missing in their lives?
Yeah, and unfortunately have not gone in there yet. I've had conversations with people who are interested in doing this, but need to do it much more. So.
In fact, I think this room is full of people who are interested in doing this in one way or another, in all sorts of
And that's exactly it, is I really just see this as a tool that we've developed that I want it to be useful to everybody else. We need to build the research base to actually answer these questions. It's a tool, and I'd love for, and that's why we're making it openly available, because we want it to be a tool that's going to be useful so that we can actually start to answer some of these questions in an empirical way.
Peggy, if the PERMA-Profiler is available open domain on wellbeing.org, if I'm a manager in a workplace and I want to see the PERMA profile for my 20 staff, is there a way that I can do that?
Yeah, that's a great question. So with authentic happiness, individuals get their scores, organizations do not. At this point, I'd be happy to give you the measures and everything, and so you can do it more internally and whatnot. Ultimately, I want to, whether it's an app or a computer or, whatever, again, bringing in the technology or whatever, but make it so it'd be possible to do that. So that's one area I want to go in the future with it. So as we roll it out, it'd be fantastic to think about how to do that.
Well, look, I think we might say that's terrific for the morning. We're going to thank Peggy, and then we'll have lunch. Thank you very much.